Good morning again. I'm Dr. Bill Wyatt. I'm a general dentist that does nothing but orthodontics and been doing that for about 40 years. And I'm a member of the American Orthodontic Society. You're a general dentist or orthodontist and you're in the American Orthodontic Society. I think you're missing out. Anyway, hope you will look at this video and you can some stuff in here you can use. Uh, this we're going to use this intruding wire that we came up with about 45 years ago. We're going to use this on an older patient. I say older, and I look back now, she's pretty young compared to how old I am. So anyway, here's the lady. This is a real nice and sweet lady, and I'm going to use these little markers when doing this. Here she is. This is 04, and she's 71 years old right now, which is not old to me. But anyway, she's got a deep, deep bite. And I've known this family and have done orthodontics for several people in the family, and they're wonderful folks. And looking at her from the front, she just needs a little extra vertical dimension in the face, and it will benefit her if we can lengthen this down a little. So we do, actually, you can do that when you get these deep bite cases. Now, when she smiles, she's kind of got her eyes closed here. I've got a bad picture of her. She's got a nice smile, nice face, everything. Now, when you look at the teeth, though, she has got a tremendous deep bite. Now, these laterals are a little bit narrow because you can't tell that until you put these teeth in the right place. And this is a real class 2 now. And then you put your central teeth in the right place. And if the lateral doesn't fill the gap, you can build it up or you can crown it. In her case, we crowned those. No, I didn't do it, but the dentist crowned those teeth. Now, look at it from the other side, the same way. It's a heck of a deep bite. You look at it from the front, and you have her open her teeth to where they're edge to edge, and she's got a gap in here. I mean, that's how deep this bite is, you see. So you're going to have to raise these teeth up, all of them. These teeth have to go down. Some people think that the bone doesn't move with the teeth. You move these 6 teeth down, and you're going to move these 6 teeth up. And I'll tell you, the bone structure where the tooth is in the bone will be the same depth when you get them up here. And we're going to raise those teeth a lot. Now, you can observe whether you believe it or not, and a lot of people don't think that you can move the whole bone structure when you move the teeth, but you can, and they move it. So, anyway, I'm going to show you when we look at her upper teeth. She's kind of worn the inside of these teeth down. The lower teeth, if you look careful, there's a little line there where the lower teeth meet into the gingival tissue. Just a little. So from the lower teeth kind of worn off here, and she's rubbed them against the upper teeth, trying to just naturally get rid of this deep bite. She's got some big old tori. If they don't bother you, you can do the orthodontics around the tori. The only problem I see is if they get too big, they force the tongue up in different places in the mouth. And the tongue might cause the teeth to actually move itself. Looking in the model, you just stick your camera up there and shoot in the back side of the model. These teeth actually contact the tissue here. So these 6 teeth, we want to take them down. We want to move them down. And this, we have an intruding wire on both the upper and lower, but I don't know as many pictures I took. I didn't take a picture of it with an intruding wire in, but I'll show you the wire of one of them in there. But we bring those teeth down, and the upper teeth, we're going to pick them up. Now you put all this stuff in the mouth to start with. Day one, we start leveling this bite. Day one. And that's the beauty of this intruding wire. You stick it on the day you start working on. So you level the arch much quicker than somebody that's going to put a regular arch wire in there and work it and level it where they can get a stiff enough arch wire in to do some work here. You can level it, and these little curved wires that come in from the back, I don't care for them either. But anyway, they'll finally get it down, but then they push the back teeth down too at the same time. Just learn how to use this intruding wire. You have to have a double tube on the molars and the triple tubes on the upper, the 6-year molars. If you do that, you can do a lot better orthodontics. All right? When I take a Panorex with an old type Panorex, show her where she bites. She's in a class 2 relationship. And these lower teeth fit up that far. And if you put them edge to edge, you don't have that kind of a gap over here in between the teeth. Like in this area, you can see it all over here. So we're going to lower this down now. If you can, let me get this little line off. But there is the bone level in these teeth. And here it is up above. And we're going to intrude these teeth quite a bit. We're going to intrude these teeth. And I tell you, this bone level will be virtually the same when you get through. I know you can intrude one tooth. If you don't intrude these, you can push it down into the bone. You can put it up and get the bone structure enough. But you can take the whole group, and this is not generally known. I've got a case where the surgeons cut the darn bone, and move it out. Because there's no bone out there where you want to put the teeth. You just move the teeth out there and the bone goes with them. They'll expand. I don't care how old you are. I've got people in their late 80s and we've expanded their teeth. Now, okay, here is the x-ray again. We still haven't got everything off of it, so you see the bone structure on the teeth. Now we'll show one. This is still the cellular x-ray. I'll just illustrate somewhere where it's class 2 and the wisdom teeth are gone. Now, Here's sometime later, 4/22/05. It's leveled now. So we brought these teeth up, and you see a little rarefied area in the periodontal membrane. If this tooth didn't die before it moved up, I think it was dead to start with. Uh, these teeth have gone down now, but the bone structure is virtually the same place in the crown it was to start with. Now we have also moved these teeth forward. You see this molar now is behind when the lower molar out in front. It's pretty close to class 2. I mean class 1, of course, a definite class 2 when we started. Okay, we to do this case, this little bite plate is back. This part right here is supposed to be right here, see? And this would be right behind these teeth. So she wore this to start with, and these teeth were not in contact like here. So they erupted together. The posterior teeth erupted together. They didn't grow anything. Note up here. On low angle cases, you put some kind of biting on this real bad case up here later. We bonded something behind these teeth. It's not too hot to bond on it because you can't really rotate or move these teeth. You've got the thing bonded to it. It has to stay in one place right here. I mean, these teeth are all be tied together like they are. And you open the bite, and then you take this thing off, and then you can straighten them out. You have to bond it on the had to bond it because he was an air traffic controller, and he had to speak, and he could not talk with this in his mouth. We took it out and bonded something on these teeth. The problem with this, because you can't move these teeth, or this acrylic is bonded to the back side. Sure you look at that video, that's extremely deep case. All right, that little bite plate we put in the mouth and open the throat, and it's not in the right place here. Took the picture of the thing, goes up here. This part is right in here. Biting point. All right, here she is her cephalometric. When it started, you see a deep biting. When you've got this type of deep bite, you cannot chew properly. You have to bite like a dog. You just go straight up and down. You kind of chop your stuff up. You don't grind it up. And you open it up and you can see the bite. The lower teeth are down. Later on, X-ray. Okay, here's the appliance in the mouth. We use these real narrow little brackets there for the rifle. But here's a wedge underneath it. This makes this tooth rotate like that. See, wedge. We hooked up the elastics, and we're pulling the lower jaw forward a little bit. As we open the bite up, then these teeth can come out from it. These teeth are torqued out now. They were kind of torqued back to start with. I'll show you the models again. The side, the same thing. Why in the world we use these double brackets? And here you don't have very much inner bracket space. These are little brackets. We've got a good space. You can use these with wings on. It gives you plenty of space and just has the same bracket. We got used to using those little narrow, very tiny brackets. They work real good, but it's harder to rotate the teeth with them. Now, here we're pulling this back for some reason, maybe rotating the tooth here. The class 2 lashes. Alright. Let's see. Machinery or the pretty simple stuff, and I didn't show you the intruding wire. It's hooked on this. It was pushing up. These are the upper teeth. It was pushing these up, actually. Same thing in the bottom. Take a picture of it. And here's the lower now. It's lowered down, and the tori and all this stuff is in the mouth. It's there. And this is the upper. Here's a good example of that little rotating wedge we put in here. You tie this in tight, and then this will push this collar back. And we like to use it because we got a real good inner bracket space that allows you to bend or flex the wire a lot. Do that. And you see this tooth, we've brought it out. We made a little out bend in the wire right through here and in bend over here. Now, I didn't make these teeth. If you don't know how to put a little out bend in the arch wire, you just can't line these teeth up very ideal. So, for God's sake, learn to bend the dead-gum wire. Go home and sit down and take you some good pliers and light and some wire and learn to bend the understand. If you want to do good orthodontics, you're going to have to learn to bend it. And these people that just think they like using a straight wire, they don't have to do it. They just buy these arch wires and plug them in. You can't really do detailed fine orthodontics that way. You've got to learn how to bend and glue in the wire. So just get down and learn it. This is the intruding wire that I use at the bottom and top. And it's a simple wire, nothing big deal. You got this little deal at the back down here. It's made that way. You angle it down. Put it in over here, it'll be down here. You made it up. Then pull these teeth down. Pick the wire up, hook it on here. We'll take these teeth down. And when it gets down, you can see these teeth are way up there. And it'll lower them down. It'll take the bone and everything down with it. Now here, this is finished pretty well. And we've got an upper retainer in there. And when we put the centrals in the right place, the cuspids in the right place, this little lateral wasn't big enough, so she went to the dentist and they crowned these two lateral teeth here on crown. I think that's a temporary crown right there. I'm not mistaken. It's a darn good looking one, whatever it is. Now, on the side over here, you see this was class 2 to start with. This molar here was behind and this one up above. And then these teeth were going up in here and they were more straight. They were straighter up and down. I'll show you the models again, the teeth in just a second. And there we are. This is class 1 over here. Now we put an upper retainer in there in a case like this. There's nothing crossing over the dead gum inside the edge. Do not use any wire going over that. You think this thing won't stay in? You can put little tiny bits of composite with a couple of teeth in there, and they fix this thing where you can hardly put it in. So, but just you leave it in a few days, and it makes a track up there in your gum, and they form a suction, and it stays in the mouth. If you have trouble with it, you put a little bit of composite, good composite, just a tiny wedge in it, and then you slide this wire snaps over it, and it stays in, and it doesn't screw up your occlusion. You've got to have the teeth come in contact with the teeth, and they work their way together down here from their chew. They wear in like a bunch of valves in an engine or something. That's necessary in retention. And this little suck down messes that they put on teeth, it don't cost anything, they're easy and quick, and you can put them in, slap them in their mouth, pat them on the rear, and they wear it a little while, and then it's gone, and your teeth move back. And I don't know how many adults bring their children in, and their teeth are not straight at all, and they had braces. So you can fix it up where it'll wear, and they can put this in at night and sleep in it anyway. But if you've got a real deep bite, you better stay with the blooming thing, or else if you had a little 3 to 3 or 2 to 2 bite plate on the back of the teeth, it's bond the upper retainer, kind of like we bond the lower deal, and have them chew against the acrylic before it sets up. Put their teeth against it, and they'll have a little shelf on the back to me, and they won't deepen that way. Otherwise, they tend to deepen after you get through with the case. Okay, got two. There's some more teeth. We bonded 3 to 3 down there. And here's the model. You see this cuspid, it's class 2. This is class 2. This tooth has to go here. This one goes here. This one goes here. Now when you open the bite up, this tooth, this lower jaw frequently will just move at least half of this way, and it's easy to come in here and give it a little help with a class 2 elastic or something, and this will change into a beautiful class 1 elation. There's the other side, class 2, the same living way. The teeth completely cover this. We're going to have the angle of these upper teeth more like that. This is going to come forward. It fills the lip out, and if you put a pad in here while they forced to intrude these, pushes this down, and these teeth will move together down here. They will erupt together, maybe, or something like that. And that up in the front is formed, so you open the vertical dimension of the face. If you do not want the vertical to open, you bond something back here in the back of the mouth, and that'll keep these teeth down while you raise the anterior teeth up. I've said this in so many times, but people don't seem to learn it very quick. You've got to, if you've got somebody that's a high angle when they come in, they already look kind of bad. See, you don't want to raise it anymore, so you put blocks on these teeth back here. You can intrude these out here and never have these come together any, and you keep the same vertical height in the face that they had when they came in. And you get them functioning right, swallowing good over a period of maybe 10, 15, 20 years. I've had cases that actually lowered themselves down. You got them swallowing correctly, functioning good, and you lower the vertical dimension of the face. All right, here's the lady, 06, and you've got a little more vertical dimension of the face now. And of course the lip is fuller out here. It's not enough to make things. It makes her look better though. And she's got a set of teeth like that now at 06. And this is an older person with braces. And the orthodontist years ago they said, well, you can't straighten anybody's teeth after 17 or 18. I'm ridiculous. We straighten people's teeth in the 80s. I never did get somebody who was 90 years old and started to do it. But I had people that went into their 90s probably doing it. Now this is the crowns on these teeth to fill that space up. There's a lot to learn in this case right here. Now it's a real class 1. You just can't get one much better class 1 than that. And this will stay, and I'll have her wear this retainer, sleep in it if it takes all her life. You just make the person look good, you straighten their teeth like they should be, and then you just retain the heck out of it. Now here her teeth are. You can see those two lateral crowns there. You see that little shadow? I know she's been wearing it. It's got an imprint of the retainer in the roof of the mouth. You made it on the model. If she loses, it lets you know you can make another one just like it, right on that same model, and stick it back in the teeth. If they drift while she's not wearing it, if she'll force it in, it'll bring those teeth back very near to this thing with the retainer. Okay, I've talked long enough here in this case. Here's see the class 2 down here, and see the class 1 up here. You just don't get them a whole lot better than that. And that's holding it. And you see this lady years after. I don't have any long-term model anything to show you here. Anyway, that's class 1. You just can't get it. The crown can be a little darker there. And that's actually that's the temporary crown. And they did do the upper. And that was a solid class 2, division 2. Now it's a solid class 1. Here's some pictures of the teeth. Now this picture here is when we started. This is when we finished. She's a couple of years older, and she's got a little more vertical dimension of the face here, and you can see it more in this picture. It's in this one right here. I didn't make her look sad over here, but she looks bright. She's happy that she's got these gorgeous teeth now, and she can have them when she's 100 years old if she lives that long. And I appreciate you watching this video. Take a little time. You can't just look at them for a minute or two if you want to learn orthodontics. And I'm interested in teaching people good orthodontics. If you're just looking at it for the show, I don't give a darn. You look at it 2 seconds and you go on to something else. If you want to learn it, you've got to watch. You've got to spend a little time, a lot of it. And that's here the teeth are. This is 2007. 2007. It's staying. And she's wearing this retainer. You can see the little line where the retainer puts against the gum. It stays in and just back in. You do not need the third class. Can't get that across to people. You don't run a wire across. If you're making the retainer coming out of here and fixing it, that's ridiculous. They hit here and they move one way where they're wearing a retainer and they move another one and take it out and they get tired of it and they quit wearing it. this is the title for the next deal. This is we're gonna do a real deep bite case. So watch that video too. So I'm gonna quit here. I appreciate you watching this, and I hope you learned something from it. So I'll say adios.